Hello and welcome to my presentation about the creation of community-based group exercise classes for older adults. So, when I thought about creating a presentation about community exercise, I thought about my place of employment, which is a nonprofit community organization that's existed since 1949. They are literally a community fixture. And we have a senior program called the Oasis program for people who are experiencing co occurring mental health with substance use disorder. And it's geared towards seniors 60 or older. It takes a team approach, and it is a therapist, a psychiatrist, and medical providers working together. They have individual and therapeutic groups, and I thought an exercise program really fits in nicely with the parameters of this program. Their goals are to improve the emotional, behavioral, and physical health of all clients, and to create a greater sense of independence, self-reliance, and well-being. So I thought, what greater way to expand upon those goals than by adding in a physical activity exercise program. So before we get into our exercise program, we need to talk a little bit about the pathophysiology of aging. So how aging affects the human body. We know that it can lead to physical, cognitive, structural, and foundational decline. We have a decline in our muscle mass as well as muscular power, and there's a gradual accumulation of body fat, especially in the middle region, which can be really dangerous and up our risks for other types of chronic disease. And fatigue is often a problem as well. It can lead to encroaching on a senior's ability to be as socially and physically active as they once were. And of course, the development of chronic diseases such as diabetes and cardiovascular disease, as well as an increase in susceptibility to obesity, is present during this time in our lives. So we know that regular physical activity is one lifestyle choice that we can make that can positively impact the risk associated with chronic disease. But despite this fact, the World Health Organization says only 1 in 2 older adults regularly undertake any form of physical activity. 50% of older adults also experience fatigue, severe enough to negatively impact behaviors, limit their social, physical, and mental activities. So on the right, you can see some of the many benefits of being more physically active and how it supports healthy aging. So we see that it can do things like regulate glucose levels, and it can improve a senior's ability to remain independent and autonomous. And it helps with sleep quantity and quality. It preserves and restores flexibility. It also can lead to increased relaxation, and it elevates our mood through the release of endorphins. And anyone who's done a pretty intense workout knows that tingly feeling. You feel like all your neurons are firing on 1,000%. That's the endorphins being released after a great workout. And we also know that research has shown that regular exercise can contribute to supporting the management of mental health disorders such as anxiety and depression. So across the lifespan, as you can see from the graph on the right, men surpass women in the number of steps that they take per day, up until about the age of 60, where women then surpass men. And there's lots of theories about why this may be. Some people feel like women are often more involved in household activities, which can involve walking. Um, but according to a 2024 study released by the National Institutes of Health, gender differences related to social connectedness can have a negative impact on physical well-being. Some men tend to have smaller social networks and also tend to spend more time alone, which can put them at risk for loneliness or social isolation. So this is something we need to keep in mind as we are thinking about getting seniors prepared to exercise. My exercise program has a bit of a social component in the aerobic activity, which is group walking. So maybe being sensitive to this tendency in some men, and we may run into some resistance with them wanting to engage in that activity. So before we get our seniors into our program, there's some things we need to do to prepare, and that would be, number one, permission, right, from the physician to ensure that we know what kind of medications they're taking, that we know about any chronic diseases they're managing, and if it is safe for the seniors to be involved in our exercise program, and of course, the timely completion of releases of information so that the doctor can share that information with us. And then we're going to move on to a self-report questionnaire that we're going to ask our seniors to complete to assess their current level of fitness, to find out, how their activities of daily living are going. Are they able to take care of those needs? And if not, what are those limitations and any past experiences they may have with exercise? We're going to do some physical assessments to assess their balance and their flexibility. And lastly, we're going to do a little goal setting. What are their goals? Do they want to prepare for a 5K, or, are they just wanting to be able to run around after their grandchildren or improve their activities of daily living? But whatever their goals are, we want to make sure that they're SMART goals, which means they need to be specific, measurable, achievable, realistic, time-bound. So here we are, our exercise program. So the 2020 World Health Organization report, their guidelines on physical activity and sedentary behavior report, calls for older adults to get 150 to 300 minutes of moderate intensity physical activity, or 75 plus of vigorous aerobic activity per week. And they also recommend that they do muscle strengthening or resistance training 2 days per week, and various activities designed to promote balance and flexibility 3 days per week. So our exercise program is a 5-day program, and it's meant to run for 8 weeks. So as you can see, on Mondays, Wednesdays, and Fridays, our seniors will do a 5 to 10 minute warm up. They do their 30 minutes of aerobic activity, which for us is going to be light to moderate paced walking. Then they do some resistance strength training. We do 3 sets of 12 with 2 to 3 minute rest in between those sets. And we rotate between upper body one day, lower body the next. And this calls for things like chair squats, mini squats with the support of a chair, seated rows using resistance bands, and plank either on their toes or on their knees. And then we finish off with a 5 to 10 minute cool down. So that happens 3 days a week on Monday, Wednesday, and Friday. On Tuesday and Thursdays, we do the same warm up. We still do our 30 minutes of aerobic activity, but we do not do the resistance training because in order to build muscle, we need to give a day of rest in between. So we then proceed to our 10 minutes of flexibility exercises like heel toe raises, shifting our weight, one-legged balancing, heel to toe walking, and then we finish, as always, with a 5 to 10 minute cool down. And so this gives us ability to fit in the flexibility, and we're also going to be working on tracking their progress. So whether that be keeping a log, or seniors using an app, or their Fitbit, or a pedometer, and we may be able to get some funding to supply our seniors with a pedometer. I think that might be the easiest way for them to track, especially if they're not too keen on technology. And they also could use their cell phone, which has a GPS tracker in it. So here we can see some benefits of walking. We know walking is a key moderate intensity activity and it's recommended by all the public health guidelines. But here are just some friendly reminders that it can reduce our chronic disease rates and our overall healthcare costs as a country. It provides weight loss benefits. It improves our cardiovascular risk factors, thereby enhancing our survival. It bolsters physical and mental health. And these last two statistics I thought were interesting. Among adults aged 50 to 70, vigorous physical activity can extend life expectancy by up to 6.3 years, and a weekly dose of moderate to vigorous physical activity, remember that 75 minutes or greater, reduces all causes of mortality by 22%. And this information comes to us from a 2023 study that was published in Geroscience, which is the official journal of the American Aging Association. So just to think a little bit about the progression of exercise as we keep this program going, we want it to be something that our seniors continue to do outside of the program. So we do, they can increase the weights by wearing a weighted vest or backpack when they go walking, walking on different terrain like sand or grass or pavement or one of those padded tracks that we see everywhere. Using resistance bands, they're available always, or your own weight is also another way to increase the intensity, and also adding an incline. If you're on the treadmill, adding an incline could help. So when you want to progress in your exercise, you're either going to increase the intensity, the amount of time, or try adding in some of these elements. Lastly, we just want to talk about the connection between physical and mental health. So from a psychosocial perspective, we know that regular exercise and participation in programs like walking promotes a greater sense of well-being among seniors and a reduction of feelings of isolation. And research has also indicated that older adults who move their bodies and who are physically active exhibited reduced levels of depression and anxiety symptoms. So this connection is relevant given that by 2025, which is the year we're in now, it's projected that individuals aged 60 years and older will constitute something like 22% of the global population. And over 20% of individuals aged 60 and older experience mental and neurological disorders. So physical activity is a simple, basic way to improve the overall health and well-being of seniors. Thank you for listening to my presentation. Here are my references.